Panitumumab Solution is a medication used to treat a specific type of colon or rectal cancer. It is a man-made protein that binds to a certain protein in the body, slowing down or stopping the growth of cancer cells. The daily dosage and optimal timing of this solution should be determined by your healthcare provider. Narration: Panitumumab Solution is administered through a vein by a healthcare professional, following your doctor's instructions, typically every 14 days. The dosage is determined by your weight and how you respond to the treatment. This medication is used to treat certain types of cancer and is an important part of your treatment plan. It is important to follow your doctor's recommendations for the best results. Some common side effects of Panitumumab Solution include diarrhea, nausea, vomiting, tiredness, constipation, abdominal pain, and growth of eyelashes. These effects may subside over time, but if they persist or worsen, it's important to inform your doctor or pharmacist. It's important to remember that your doctor has prescribed this medication because they have determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, it's crucial to seek immediate medical attention if you experience any serious side effects, such as swelling ankles or feet, unusual weakness, irregular heartbeat, severe muscle spasms, mouth sores, signs of eye problems, signs of lung disease, or changes in your menstrual cycle. Prolonged or severe diarrhea can lead to dehydration and electrolyte imbalance, so it's important to contact your doctor if you experience extreme thirst, decreased urination, dizziness, or fainting. In rare cases, panitumumab can cause very serious infusion reactions, including allergic reactions. Seek medical help immediately if you develop fever, chills, or symptoms of an allergic reaction. While a serious allergic reaction to this drug is rare, it's important to seek medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed here, it's important to contact your doctor or pharmacist. If you're taking Panitumumab Solution, you should be aware that it can cause serious skin reactions that may lead to infections. If you notice any signs of a skin reaction such as acne, mild rash/itching, warmth/redness/swelling of the skin, dry/flaking skin, or skin sores, it's important to inform your doctor immediately. Additionally, seek medical help right away if you develop signs of a serious infection such as fever, fast heartbeat, mental/mood changes, or signs of kidney problems. It's important to be aware of these potential side effects and seek prompt medical attention if you experience any of them. Before using Panitumumab Solution, it's important to talk to your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions. It's also crucial to discuss your medical history, especially if you have lung disease or low magnesium/calcium blood levels. If you're using Panitumumab Solution, it's important to limit your time in the sun and avoid tanning booths and sun lamps. Be sure to use sunscreen and wear protective clothing when outdoors to prevent any skin reactions. If you're planning to have surgery, it's essential to inform your doctor or dentist about all the products you're using, including prescription drugs, non-prescription drugs, and herbal products. If you're pregnant or planning to become pregnant, it's vital to talk to your doctor about using reliable forms of birth control while using Panitumumab Solution and for 2 months after the last dose. If you become pregnant, be sure to discuss the risks and benefits of this medication with your doctor. Additionally, this medication may pass into breast milk, so it's important to consult your doctor before breastfeeding while using Panitumumab Solution and for 2 months after the end of treatment. When taking Panitumumab Solution, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's essential to keep a list of all the medications and products you are currently using, including prescription and non-prescription drugs, as well as herbal products. Make sure to share this list with your doctor and pharmacist. Never start, stop, or change the dosage of any medications without consulting your doctor first. This will help ensure the safe and effective use of Panitumumab Solution. If someone has taken too much Panitumumab Solution and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Before starting Panitumumab Solution, your doctor may need to conduct lab or medical tests to check your magnesium and calcium levels. These tests should continue while you are using the medication and for 8 weeks after you have finished treatment. It's important to attend all scheduled medical and lab appointments to monitor your progress and discuss any concerns with your doctor. Make sure you take each dose of Panitumumab Solution as prescribed by your doctor. If you happen to miss a dose, make sure to consult your doctor or pharmacist to create a new dosing schedule. You may be wondering about the uses of Panitumumab Solution. This medication is used to treat certain types of cancer. It is given through a vein in a clinic or hospital setting. Your healthcare provider will determine the correct dosage and timing for you. It is important to follow their instructions carefully. This medication will not be stored at home, so it is important to attend all scheduled appointments for your treatment. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.